In the previous lecture, we studied the normal histology of the lower female genital tract, including the vulva, vagina, and cervix. In this lecture, we'll continue our journey further into the female reproductive tract and study the normal histology of the uterus and the fallopian tube. We'll begin with the uterus and understand the microscopic structure of its three layers: the endometrium, myometrium, and perimetrium. We'll then study the fallopian tube, focusing on its mucosa, muscularis, and serosa, along with the specialized cells that make it uniquely suited for ovum transport and fertilization. We'll also correlate the microscopic architecture with its function, learn the cyclical changes seen in the endometrium during the menstrual cycle, and finally discuss the key histological features that help identify these organs under the microscope. So, let's begin with the histology of the uterus. The uterus is a hollow, thick-walled muscular organ whose wall is composed of three distinct layers. From inside out, these are the endometrium, the myometrium, and the perimetrium. Each layer has a characteristic microscopic appearance and performs a specific function. Together, they enable the uterus to support implantation, sustain pregnancy, and generate the powerful contractions required during childbirth. We'll begin with the innermost layer, the endometrium, as it is the most dynamic and clinically significant part of the uterine wall. The endometrium is the mucosal lining of the uterus. It is lined by a simple columnar epithelium and is supported by a highly cellular connective tissue known as the endometrial stroma. Embedded within this stroma are numerous simple tubular uterine glands, which are one of the defining microscopic features of the endometrium. Although the endometrium appears as a single layer under low magnification, functionally it is divided into two distinct zones, the stratum functionalis and the stratum basalis. Understanding these two layers is the key to understanding the cyclical changes that occur in the uterus during the menstrual cycle. So, let's study each of them separately. The endometrium is divided into two functional layers, the stratum functionalis and the stratum basalis. The stratum functionalis is the superficial layer. As the name suggests, it is the functional part of the endometrium that undergoes cyclical changes during every menstrual cycle. Under the influence of ovarian hormones, this layer proliferates, becomes thicker, develops secretory activity, and prepares the uterus for implantation. If fertilization does not occur, this entire layer is shed during menstruation. The stratum functionalis itself can be further divided into two regions. The superficial stratum compactum, which contains densely packed stromal cells and the terminal portions of the uterine glands, and the deeper stratum spongiosum, which contains the more dilated and tortuous portions of the glands, giving it a spongy appearance under the microscope. Beneath the functionalis lies the stratum basalis. Unlike the functionalis, this layer is not shed during menstruation. It remains attached to the underlying myometrium and contains the basal portions of the uterine glands along with progenitor cells that regenerate a new stratum functionalis after every menstrual cycle. This remarkable ability to undergo repeated shedding and complete regeneration without scar formation makes the endometrium one of the most dynamic tissues in the human body. The blood supply of the endometrium also reflects this functional organization. The straight arteries primarily supply the stratum basalis, while the spiral arteries extend into the stratum functionalis. During menstruation, constriction of these spiral arteries produces ischemia, leading to degeneration and eventual shedding of the functionalis, while the basalis remains intact and serves as the source for regeneration of the next cycle. Myometrium. Just beneath the endometrium lies the myometrium, which forms the thickest layer of the uterine wall. Histologically, it is composed of interlacing bundles of smooth muscle fibers separated by varying amounts of connective tissue containing blood vessels, lymphatics, and nerves. Although the muscle fibers are often described as being arranged in three layers, these layers are poorly defined and blend into one another. The inner and outer portions are predominantly longitudinal, while the middle layer, known as the stratum vascular, contains abundant large blood vessels arranged within densely packed smooth muscle bundles. The myometrium is highly responsive to hormones. During pregnancy, smooth muscle cells undergo marked hypertrophy, increasing several times in size to accommodate the growing fetus. Following delivery, these muscle fibers gradually regress toward their normal dimensions. The coordinated contraction of the myometrium is essential for menstruation, labor, and postpartum control of bleeding. Moving outward, the outermost layer of the uterus is the perimetrium. The The perimetrium is a thin serosal covering composed of mesothelium resting on a thin layer of connective tissue. It covers most of the outer surface of the uterus. However, where the uterus is directly related to surrounding pelvic structures, this serosa is replaced by adventitia, which anchors the uterus to adjacent tissues. With the microscopic structure of the uterine wall now complete, let's move on to the second major organ of today's lecture, the fallopian tube. The fallopian tubes, also known as the uterine tubes or oviducts, are paired muscular tubes that extend from the superior angles of the uterus toward the ovaries. Their primary function is to receive the ovulated oocyte, provide the site for fertilization, and transport the developing embryo to the uterine cavity. Like the uterus, the wall of the fallopian tube is also organized into 3 layers: the mucosa, the muscularis, and the serosa. The mucosa is the most distinctive and easily recognizable layer under the microscope. It is thrown into numerous longitudinal folds that project into the lumen. These folds are relatively simple in the isthmus but become progressively taller and more branched toward the ampulla, where they create a highly complex, labyrinth-like appearance. The mucosa is lined by a simple columnar epithelium composed of 2 principal cell types, ciliated cells and secretory cells, also known as PEG cells. The ciliated cells possess numerous motile cilia on their apical surface. Their coordinated beating helps propel the oocyte or early embryo toward the uterine cavity. These cells are particularly abundant in the infundibulum and ampulla and increase in both number and activity under the influence of estrogen. Interspersed among them are the secretory, or PEG, cells. These non-ciliated cells produce a nutrient-rich fluid that supports the survival of sperm, nourishes the ovum, and provides an optimal environment for the early embryo before implantation. Beneath the epithelium lies the lamina propria, which consists of loose connective tissue. Unlike many other tubular organs of the body, the fallopian tube does not possess a distinct submucosa, and it contains no true mucosal glands. The extensive mucosal folds themselves are sufficient to provide the large secretory surface area required for its function. The muscularis forms the middle layer of the fallopian tube and is composed of smooth muscle arranged in 2 layers, an inner circular layer and an outer longitudinal layer. Although these layers are not always sharply demarcated, together they generate rhythmic peristaltic contractions that assist in transporting the ovum and the early embryo toward the uterus. It is important to remember that transport through the fallopian tube is not accomplished by ciliary movement alone. Instead, it is the combined action of ciliary beating and muscular peristalsis that ensures efficient movement of the ovum through the tube. The outermost layer is the serosa, which consists of a thin layer of connective tissue covered externally by simple squamous mesothelium. As part of the visceral peritoneum, the serosa provides a smooth, friction-free outer surface for the tube. Now that we have studied all 3 layers, let's summarize the microscopic features that help identify the fallopian tube under the microscope. The first striking feature is the presence of numerous branching mucosal folds, especially in the ampulla, producing an irregular and highly folded lumen. The lining epithelium is simple columnar and is composed of a mixture of ciliated cells and secretory, or PEG, cells. Unlike the uterus, true endometrial glands are absent, and there is no distinct submucosa. Surrounding the mucosa is a 2-layered smooth muscle coat, followed by an outer serosal covering. These characteristic features allow the fallopian tube to be readily distinguished from other parts of the female genital tract on histological examination. Before we conclude today's lecture, let's compare the uterus and the fallopian tube side by side. This not only reinforces the concepts we've learned, but also helps in identifying these organs quickly during practical examinations. The uterus is characterized by a thick endometrium lined by simple columnar epithelium, supported by a highly cellular stroma containing numerous simple tubular uterine glands. The endometrium is organized into the stratum functionalis and stratum basalis, and is surrounded by a remarkably thick myometrium composed of interlacing smooth muscle bundles. In contrast, the fallopian tube has a highly folded mucosa lined by simple columnar epithelium containing ciliated cells and secretory, or PEG, cells. It contains no true glands, no distinct submucosa, and is surrounded by a relatively thinner muscularis composed of inner circular and outer longitudinal smooth muscle layers. A simple way to differentiate these 2 organs under the microscope is to ask yourself 3 questions. First, do you see numerous simple tubular glands? If yes, you are most likely looking at the uterus. Second, do you see a highly folded mucosa lined by ciliated and secretory cells without true glands? If yes, it is the fallopian tube. And third, look at the muscle layer. A massively thick, smooth muscle wall favors the uterus, whereas a much thinner, two-layered muscularis favors the fallopian tube. Keeping these distinguishing features in mind will make histological identification much easier, both in examinations and in routine microscopic practice. In the next lecture, we'll continue our journey through the female genital tract by exploring the normal histology of the ovary, where we'll study the microscopic structure of the ovarian cortex and medulla, the stages of follicular development, ovulation, and the formation of the corpus luteum. Until then, thank you for watching.